This is a plain paranasal sinuses scan of a 21 years old male patient. The patient has been previously operated upon for turbinectomy, septoplasty, and for some other reason. The clinical details, they were not provided. Now please observe and follow the right frontal lobe. Now this is the fissure between both cerebral hemispheres. As I scroll it down, it is displaced slightly towards the right side. Now please see this brain tissue extending downwards into the right ethmoidal sinus, and when I trace it down, it further extends downwards into the upper part of right nasal cavity. This one here, its upper part density is same as that of the rest of the brain. I wish a contrast NAN CT scan was carried out, but since the advice was for the plain scan and the referring ENT surgeon did not expect this to be the herniating brain tissue, so only plain scan was advised. It extends downwards. Its lower part has cystic attenuation values. So it is the herniated frontal lobe and its meninges through right ethmoidal sinus into upper part of the nasal cavity. This is the coronal scan. Please observe that this is the left inferior turbinate. On right side, turbinectomy has been done. Now this is the mass here. Now this has the fluid attenuation value suggestive of CSF. Floor of right maxillary right ethmoidal sinus is deficient. Right cribriform plate is deficient here. This is the lower part of right frontal lobe, which is extending into right ethmoidal sinus and into upper part of the nasal cavity. Now this is the fissure between both the cerebral hemispheres. It is directed towards right side. It was wise of the ENT surgeon to ask for the CT scan, because if this was operated upon thinking of as a nasal mass, the consequences could have been catastrophic. This is the sagittal scan. Please observe deficient cribriform plate and the cerebral tissue extending into the ethmoid sinus and the upper part of nasal cavity. This is the CSF here. Bone window details. Deficient cribriform plate, floor of right ethmoidal sinus, and cerebral tissue extending downwards into the ethmoidal sinus and upper part of nasal cavity. Inflammatory mucosal thickening in left sphenoidal sinus and right maxillary sinus. Axial scan, bone window details from above downwards. Continuation of soft tissues into right ethmoidal sinus and upper part of right nasal cavity, suggestive of the extension of frontal lobe into the ethmoidal sinus and the nasal cavity.